Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Got a very special guest here today who I've known for many years, Dr. Mike Adler. Now, it's such a pleasure to have you here. I've been wanting to get you on my podcast for years, and finally we have it. Only because I've asked you to play pickleball.
Well,
that's
you.
That's a result of this. But in any event, you might know Mike and his lovely wife Kim as the creators and host and stars of Dancing with the Stars, of which our son Andy has been in. And it's just a wonderful event. As a matter of fact, I think that's the nicest event of the whole Tri-Cities every year.
Well, thank you.
I don't think anything compares to that. If you haven't seen it, you need to go to it because it's very entertaining and sort of great calls as well. And we'll talk about that in a minute. But Mike is a clinical psychologist, a PhD psychologist who specializes in sexual abuse and trauma. And we're going to dig and unpack a lot of this in a minute because it's really fascinating to me to know how much of this goes on and how much it affects people later in their life. A lot of times I'll be sitting there with a patient who has a chronic disease, and when I start really digging in and asking them about their lives, because a lot of times I find that, in my practice, really I look at the physical, the mental, and the spiritual. And the mental is so complex that a lot of times I'll be dealing with somebody that I can't quite figure out why they have this problem of chronic pain, or they're always depressed, or it may be a woman with fibromyalgia, which to me is highly linked to sexual abuse in early age. I don't know what the stats on that, but I think it's incredibly high according to a lot of experts. But so we really kind of skip over those things. A lot of times as doctors, we're in a hurry. We want to get out of the room. I don't do that in my practice because I'm a little different type of doctor than I used to be. So I like to really get to know a person and get to know the root cause of their problem. And a lot of times when you start unpacking these things with patients, you realize there's something a lot deeper here than what's meeting the eye, what's on a lab test, and what, they may have obesity, or they may have chronic depression, or they may have been suicidal. So, it requires a lot of time spent with these people, and a lot of times there's sexual abuse at the very beginning of it that affects their whole lives and leads to chronic illnesses. Am I right?
I would agree with that. So early abuse, early trauma, without the ability emotionally, physically, mentally to process that or deal with that or have support, has to go somewhere. And so oftentimes that becomes internalized, and it wreaks havoc on probably many of our systems, which hormonal, certainly, the stress level and what that does to our overall health. We know that it has ramifications for heart disease. There's so many different things that early trauma that's left avoided or ignored the person would experience.
We always talk about stress in our practice, but we don't really talk too much about the past, the early life that probably affected that person and their outlook on life, maybe even their self-esteem.
Right.
Because, we see a lot of self-esteem issues in medicine, especially when you deal with obesity, like I do in my clinic every day, which to me is the number one health problem in America is obesity. And a lot of that stems from the terrible food that we have in our country, the sugar addictions and all that. But I've got a feeling there's a much deeper cause of overeating and choosing the wrong food choices like sugar, because it gives that dopamine release to makes you feel good for a short period of time. But you think a lot of that's rooted in self-image and going back to abuse as a kid? And I'm not talking just about sexual abuse, which is your specialty, but didn't you tell me that neglect is also maybe the main form of abuse of a kid?
It's probably the most common, totally, in numbers, as children are left alone or not supervised or not cared for lots of reasons. So yeah, and when we think about the food issue and obesity, eating sometimes is a very unhealthy coping mechanism for feeling bad, feeling unhappy. So I think that's there's certainly a causal, or if not a causal, certainly a strong correlation.
You know, when you deal in your practice with victims of sexual abuse, you also deal with the sexual abusers, which is what fascinated me, because the abusers usually were abused themselves. Is that right? How common is this? You know, we all saw the Sounds of Freedom and the current epidemic of this sex trade, which is just unbelievably evil. But talk to me a little bit about how common sexual abuse is, and in your experience, how do you approach patients and abusers with this dilemma?
Well, so there's a high correlation of sexual abuse with the people that we see who abuse. It's not a causal effect, but it's a strong correlation. So over the 40 years that I've been working in this field, it varies a little bit, but 75-80% of those people have experienced early sexual abuse themselves. However, on the flip side of that, it's not a causal effect. Only 1 out of 4 individuals who are sexually abused would actually sexually act out. So it doesn't mean someone will actually turn out, but it certainly is a strong correlation. And so we have to deal with, again, what is the early experience? In the state of Tennessee, the most common age of a child being abused is 8 years old. We could explain that, but that would probably be another podcast. But so if we think about what's going on as a doctor, as a medical doctor, of what's going on at that age, 8, 9, 10 years of age, there's lots of hormonal changes going on and growth, and certainly the abuse that occurs at that time is going to have an absolute impact on all of those systems.
You know, the mind is such an important thing. You told me a term that I'd never heard before called hyperthymesia,
Yes.
which is a rare condition where people can remember everything
they experience. And the reason that's important for me as a person who treats and tries to work through, what we oftentimes don't pay attention to is that we think that because we can't remember things that they no longer impact us. And that's just not the case. We are if I introduce myself, it would be, I am everything I've experienced. And so the ability to recognize those experiences and the impact, how I perceive those experiences, is the internalization of that. And what does that teach me about myself? And that's such a critical component to understand, because I look at mental health as I'm 3 people: the person I am, the person I want to be, and the person I should be. The further away I am from those 3 people, the more difficulty I have emotionally and mentally. And so depending on those experiences, that's going to impact what my perception of who I should be, but who I am, and those things don't match. And that's where we get into a lot of the mental illness and a lot of the bad, negative, self-destructive behavior that wreaks havoc on our system.
So I'm thinking about what you just said. So when you're a person who obviously remembers a lot of things, as we all do, we all try to clear those thoughts from our heads, the bad thoughts.
Right.
So is it a good idea to try to clear those bad thoughts out of your head, or what bad may have happened to you, or do you need to get it out and deal with it?
Well, personally and professionally, I think dealing with those is probably the better thing to do. And the reason I think that is because so much of what we believe about ourselves happens by the age of 6. And so those experiences happen when we're egocentric thinkers, which means we can't really formulate possibilities of why I'm being treated the way I'm being treated. I can only focus on it's got to be something to do with me. And so that's going to lead to childlike beliefs about myself, which are not accurate. And so being able to go back into those experiences and understand how I've distorted that my father never being around because he worked 3 jobs wasn't because he didn't love me, but that's what I believed when I was 4 years old and 5 years old. So we can go back and we can look at how we made sense of those things and change that through cognitive restructuring, which would then help a person to have a better, more accurate picture of themselves.
That makes sense. So you can begin to understand maybe why your parents were like that.
Yes. And we don't, and it's not blaming parents. It's not saying anything. We're not making a judgment. The issue is how I perceive what was happening to me from a child's mind, which in cognitive development is very egocentric, which just means I can only think about my world being what relates to me, and everything that happens to me has something to do with me. So I can't think that my father's having a really bad time, or my mother's having to work 3 jobs and is not sure if she can pay the bills and doesn't have time for me. I don't understand that at 4 or 5 years old. I just know she's not there and she doesn't seem to have or want to do anything with me.
Boy, being ignored is one thing with its consequences, but being sexually abused to me is a much on a different level of trauma that people have to deal with later in life. How do you approach that when, somebody comes to you and they realize that 30 years ago they were sexually abused, and what's your game plan of helping that person get better?
Well, so we've got to deal with the shame and guilt that's, again, distorted. As a child, they didn't do anything wrong, but yet almost all of the victims that I work with feel ashamed or guilty for what happened. And sometimes that becomes extreme, and so that becomes a way for of them just kind of attacking themselves. So we have to help them to recognize that what happened to them wasn't their fault. That's the first thing, and then we can start to unpack how they distorted what happened to them and took responsibility that was not theirs to take, and kind of empower them to survive that.
In talking with the abusers, is there anything that kind of stands out to you when they talk to you confidentially about why they did what they did?
Well, it's their inability to feel loved, to believe that someone would care about them, and the only way that they could believe that someone would care or like or love them would be to trick them or coerce them or manipulate them.
And how common is that?
As far as the number of people who actually offend, or as how common is that the response?
How common is it that people do that type of thing early on? Common. Much more common than people realize.
Yes.
Just like when you saw the movie Sound of Freedom, the trafficking is way more common than most of us even can think about.
Correct.
It's hard to deal with when you really start thinking about it.
It is. It's overwhelming, and I think it's one of those things that's uncomfortable, and I think people would prefer not that it happened, but certainly don't know what to do or how to deal with it, so it kind of gets pushed away.
So it's hard to think about, and people do, like you say, people want to kind of just maybe not ignore it, but just don't talk about it. I think the same thing happens with doctors and patients, especially from the medical aspect. When people come to you, they're pretty much need to talk about what they need to talk about. But in general, with your medical community, I think they tend to ignore this or brush it aside and try to come up with a pill that will help you feel better, an antidepressant, a medicine for anxiety, when really you're just masking the problem. You haven't really dealt with the issue, and that's what happens in medicine, I think.
Well, and I'm going to say this, and these people have these symptoms, and I'm sure that they feel bad and they have these health problems, but many of these individuals probably manifest these problems, these health problems are manifested as a way to ask for help for things that they've not probably dealt with emotionally. And so my depression, or I don't have energy, or I can't seem to get on track, those things are, we look for doctors to fix that with a pill or with some kind of medical, biological base of treatment. And there's a role for that. But if I could look at the things that I believe about myself that I'm uncomfortable with, I don't really want to talk about those things. I don't even really want to acknowledge them. But if I could slay those demons and be free of that drag on me, and then I might be able to respond, and certainly respond even more to the work that you do.
And actually get better.
Yes.
I think that's very important. And what you say is very true. You know, we need medications to help for severe cases of depression and anxiety as well. I mean, there's some people that have to have an anxiety medicine. You know, a lot of doctors just demonize every anxiety pill or won't give it because it's a controlled substance. But some people actually do need them, and some people need antidepressants as well.
Yes. I don't. And again, I don't want anyone to take that I'm saying it's psychosomatic. It's not. But I do think that probably in many cases the only time that they were cared for, and particularly in these neglect and abuse cases, is when they were sick.
Exactly right. And they have that sick role, that sick model, you know. And I certainly do not try to overprescribe medicines. If anybody knows me, they know I probably spent the first half of my career writing prescriptions, the second half of my career getting them off these medications that they don't need long term. They have their uses, but certainly I'm all about trying to find out the root cause of the problem, like you are. Unfortunately, a lot of people come to the doctor, a medical doctor, for a pill. I mean, it's easier for a doctor. Yeah, here's your pill. This is going to make you feel better. I'll see you. In a way, that's a cop-out for a doctor, because it's not really helping them that much.
Right.
It's just masking the problem. Like I said, it has its uses, but it's not solving the problem. The older I get and the more I practice medicine, the more I try to get to know my patients, and the less afraid I am of asking them the true gritty questions. A lot of times after I've seen a patient a few times, and I really, you know, if you're an astute doctor, if you're experienced, if you've got some common sense and you really care, that's another thing, is caring, then after a while I'll start talking to my patients and I'll go, you know, really, what is the cause of your problem? Why are you here? What are you worried about? Let's dig a little deeper into this thing, because, you know, it seems like I'm not really helping you as much as I could be helping you get to the cause of this. Why are you hurting so much all the time? Why are you chronically tired? Why are you depressed? Let's try to get to the bottom of this. And a lot of times, in my case, it's referring to people that can unpack this in lengthy sessions. Right. And in my experience, if a patient's willing, and if a doctor can motivate them and let them know that that's the answer, to send them to a psychologist or a counselor. A lot of times it'll be a clergyman, or it can be a friend, just somebody to help them unpack this. We all need people.
Right.
We're a community. We're not isolated. We cannot get better by ourselves. I believe that.
Absolutely. Certainly what I have found in my practice is people who have a social support system, a positive social support system, are much better off than people who do not. It's certainly a critical risk factor for poor mental health and behavioral problems and just life happiness.
You know, we hadn't even talked about the spiritual part, which is another topic. We talk about that some, but, you know, I saw you in church today.
Yeah.
So, you know, a lot of times you need to go there for your answers as well. But, and certainly when you visit a doctor, if you're chronic and they're not getting to the cause of the problem, start thinking about, you know, the stresses you've had in your lifetime, the bad experiences you've had. We all know about post-traumatic stress disorder, which is very, very common, and not just among people who go to war or who've been sexually abused as kids. There's a lot of traumas that people have gone through, and people react differently to it.
Right.
And it needs unpacking. So, Mike, what last advice would you give people? Where do they go for help? If they're watching this video, or their friends are talking about it, where do they start this process of really true healing?
Well, being brave to face the experiences that they've had would be the first thing. I think for me, dealing with that and opening up about that and realizing that a lot of the things that we believe about ourselves are not nearly as bad as we make them to believe, and we do have a tendency to view the negative sides of ourselves, and to stop comparing yourself to other people, because you're never going to win that comparison. In a comparison, I'm going to compare my deficits to your strengths, and I'll never win, and it will just continue to reinforce that there's something wrong with me. So that would be the second thing. Third is to get professional help. There's lots of good places. The mental health system here does a lot of good work with trauma. Certainly the ETSU psychology and psychiatry department, they have great resources. So that's what I would do, is be willing to face this.
And if you're a victim of sexual abuse, you need to see a specialist that deals with that.
Right. So looking at someone who has history of working with victims and working with trauma, actually Northeast Tennessee has a number of very good professionals that work with trauma and do a great job working with helping victims deal with those things and getting on with their life.
Well, I agree with you that it's so important that you find somebody that you can talk to. And, you know, we shouldn't be isolated.
Right.
We're a community. Our life is not a competition. It's
Correct.
really a chance to help other people out as well. So I think we've got to certainly have a great community here in Tennessee.
Yes, we do.
And that's one good thing about living here in East Tennessee, that for you people that are looking at this from other parts of the country, I'm sure you've got great communities too, but we do have a close-knit community, and we have a lot of resources to help people. So if this podcast, if you can kind of relate to it or know people that you think may benefit from this, please help them to tune into this. And Dr. Mike Adler, thank you so much. We'll have to do more podcasts, get into more specifics about, mental health.
Okay. Well, thank you so much for having me.
Thank you. And we'll go play pickleball.
Okay.
Thank you. We'll see you next week.
Okay, I would like to just take one last moment to let you folks know, if any of these things are things that you're struggling with, remember, when you seek a professional, that nothing you're going to tell them is going to be something that they haven't dealt with or had experience with, and don't feel that what you've gone through is something that can't be addressed by those individuals.